what I want to focus on a little bit is acupuncture, because that is one that is the most common out of traditional Chinese medicine. It's one that our society, Western medicine, is now taking into more consideration. There are over 100 disorders that are commonly used to treat acupuncture or treat disorders. Acupuncture is one of the most commonly used medical procedures in the world. Not in the United States, but in the entire world. In the United States, there are 3.5 million U.S. adults have used acupuncture in the last 5 years. Acupuncture treats over 100 clinical disorders. I'm not going to list all 100. There are a lot of them, but the more common ones are like pain. It treats asthma, treats tennis elbow. Anyone play tennis, or anyone know who plays tennis? So we start getting a few overuse, things like that. Also, it can treat depression, trauma, so like an example of a car accident or something like that as well. So I'll give you a list of some of them as well. The one thing that they are starting to show is that it does actually use for addiction and smoking cessation. You do actually use that. They're showing that people go for acupuncture to stop smoking, so to prevent that. The way it works is they still haven't quite figured out how things work.
I think it's important for the campus because now they're taking consideration other people's health. Secondhand smoke, we've seen that it does affect other people, and also now we're looking at the park, beaches, and other things have implemented that. So I guess they're tagging along on that, and that's I support it at least.
Cigarette smoking is really bad, since tobacco is not good for your health at all. They have a lot of chemicals and stuff in it. God knows what the tobacco companies are putting in it. They don't have no ingredients or nothing on the box. It tells you what's inside the cigarette. So, and definitely it's bad for you. He's talking about secondhand smoke. So it's bad for the people around who who are not smoking it either.
I used to smoke black and milds for maybe a couple of months, but I have asthma, so I just stopped smoking. My family's always been smokers. My dad used to smoke packs a day. My mom used to smoke, and I've had asthma since I was a baby, so it doesn't make it any sorry guys, doesn't make it any better. Smoking's terrible. I have asthma, and I was smoking, and it really took a toll on me. I couldn't breathe. I had to go to the hospital. They had to hook me up to an IV because my lungs closed so much that I couldn't breathe at all. So I think it's just really bad, and I don't smoke anymore.
The tobacco companies aren't looking out for anybody, so it's good that somebody's looking out for the students, and I'm glad that, I hope they put this into phase, and I think it's a good thing. I think all negative things should be away from the school. Any health hazard whatsoever. I think smoking is bad enough as it is for one person, let alone two.
Never was a smoker, but I know it's an expensive habit. I'm a full-time student, and I hardly can afford a Metro card, so smoking's out of the question.